Our agenda. There is a little wrinkle in here about the healthcare services ordinance. So Kevin will talk about that. It's a potential solution for you. But let me get into the presentation. So CCHP is a health plan, but I want you to think of it in the context of an integrated delivery system. What we mean by that is that we're not just one part. We're not just a health plan and that's about it. You'll hear from our history that we came out of a really specific need to serve the local community, and it's just evolved over time. We are made up by the health plan, the hospital and its clinics, and the medical group, CCHCA, and I'm going to talk about each one of those. This is important. I think a lot of people understand that CCHP has been in San Francisco for quite some time. This gives the context of why. So this is our timeline. It's in your pamphlet. I want to talk first about the fact that our delivery system has been here since 1899. Why 1899? Well, back then, there were a lot of Chinese who lived in San Francisco in the Bay Area. They were laborers. They helped build the railroads. They were gold miners, and they worked the laundry, and so on. But at that point in time, the residents in Chinatown at the time really had a tough time getting access to health care. In fact, they were discriminated against, and they, quite frankly, didn't have access. So what happened in 1899 was that community organizations got together and said, you know, this is not right. We need to give these citizens access to health care. And so they formed what's called the Donghua Dispensary on Sacramento Street. And that's where, Western doctors came in and complemented with the Eastern doctors with herbal medicine, traditional medicine. That all burned down in 1906. They rebuilt it. The community ballooned beyond the demand there. And then in 1923, the same community organizations got together and formed what's called Chinese Hospital Association and formed basically Chinese hospital. Now, back then it was not unusual for different communities to have their own hospitals. I think people who grew up in San Francisco remember French Hospital. People who come from other places know about Catholic hospitals, Presbyterian, that sort of thing. Well, it was not unusual for each community group to build their own hospital, and that's in fact what happened in 1923. So that stood there until, so it was completed in 1925. So anyone who was of Chinese descent in San Francisco pretty much was born at Chinese Hospital. And in fact, Bruce Lee was born there. I don't know how many of you know that. Bruce Lee is one of the most famous people born at Chinese Hospital.
And you.
Well, you stole my punchline. You stole my punchline. So, and I'm actually a proud product of this hospital as well. Let me tell you a story about my family. My parents came over in '63, November, when JFK was shot. They packed up, got on a boat, 4 kids, landed on the shore, no jobs, didn't speak the language. He had 2 engineering degrees in Hong Kong, but he had no job there because they didn't recognize his degrees. But he lived in a basement apartment on Telegraph Hill, and 3 months later I was born at Chinese Hospital. Now, that's the story of why this delivery system exists. The community is changing. I'm happy to be back to be part of this. Oops, let me go back to this. And in 1979, hospital requirements changed. So this new hospital to the right was built, and the old hospital was just an administrative office. Okay, so healthcare in general, in terms of the delivery system, also changed in the 80s. So what happened? A lot of health plans were going towards managed care. So a lot of the residents continued to grow from the community. They were working jobs, they were working for large employer groups. They signed up for their health insurance, and they couldn't see their doctors. Well, why not? Well, it's because the physician organizations, the physicians around Chinese Hospital were not a part of an organized delivery of care system. So in 1982, the physicians formed their own IPA, Independent Physician Association. To this day, they're a third largest, or actually the third IPA in San Francisco. So you all know about Brown and Tolan, you all know about Hill, CCHCA is the third. Some of the doctors belong to some of the other ones and vice versa. So that enabled the hospital and the physicians to continue to see their patients through Blue Shield, through Anthem, through HealthNet, but not Kaiser because it's not Kaiser. In 1986, CCHP was brought on board, was created to do the administrative functions that you need to do for if you're taking managed care lives. So you need to process claims, you need to do utilization management, you need to make sure you're managing your eligibility enrollment. And from that point on, CCHP just started developing their own products as well to supplement what they were getting from the other carriers. So we continue to evolve. The hospital created a lot of satellite clinics because the community is not just in one location. The people who are served by these doctors are not just Chinese. And so you'll notice that our latest clinic, it's our 5th one, possibly 6th, depending on how you count, called East West Health Services. It's located on Commercial Alley between Kearney and Montgomery. And it really is East-West integrated medicine. So you can go there to, get your traditional Chinese teas brewed, acupuncture services taken care of. Okay? So it's kind of like a full circle if you think about it. So this is just, we're pretty happy about this. Thank you, Amy, for updating the picture. This is a picture of our new hospital that's going to be completed in 2016. This is a big deal. CCHP, Chinese Hospital, is the last remaining independent hospital in San Francisco. I think you guys know CPMC, Dignity, Kaiser, they're kind of lumped together. But that's the last standing independent hospital here. There are 54 beds. There's going to be 3 new surgical suites built. So there's new surgical services that will be provided at the new hospital. We're going to add 22 new skilled, I'm sorry, I'm blocking you. So I'll stand over. It's okay. I'll stand here. Okay, so one of the things that the city is lacking in is skilled nursing facility beds. So acute beds is where people go if you have a tricky surgery, and then we want to send you home as quickly as possible. Sometimes you can't go home, you have to go to a skilled nursing facility, but in San Francisco there's a shortage of that. So we're adding 22 new skilled nursing facility beds there. Okay. So there's some, as services change for the footprint that we have, we continue to evolve. So this is just a picture of the topping ceremony. In February, we put up the last beam. So construction is going fast and furious. It's 1 block away from the new Central Subway stop, which is going to be interesting. So there's a lot of construction around it, but we're happy that it's on schedule. Okay, so let me talk about CCHP. So I think a lot of you know, we're a pretty good local health plan. I want to talk a little bit about some of the other successes that you may or may not know about. So first of all, we are open to all residents in San Francisco and northern San Mateo County. When I say northern San Mateo County, we're talking about if you took the San Mateo Bridge and just sliced it across San Mateo, anything north of that is available. So we're open to all who live or work in our service area. The answer that I always give out to the question I get most often is no, you don't have to be Chinese to join a health plan. People think that. I can barely speak it, as you can tell. I was born here. Anyway, one particular item that we're proud of is that we have a Medicare Advantage plan. Medicare Advantage plans, when private plans take risk from CMS, so we cover all that Medicare covers plus more. CMS ranks plans on a star rating. The 5-star is the highest, so there's only one plan in our service area higher than us, and that's Kaiser. So we have a 4-star rating, so that qualifies us for quality bonuses. So we're happy about that. For 2 years in a row, we've gotten that rating. We're going to try to get to a 5-star. It's tough. That's why there's only one plan in our area. In 2013, you know that we were awarded a contract to be in Cover California. When Cover California started, they actually reached out to all the health plans in California. 33 health plans said, we're interested in bidding. And when they got down to it last May, they selected only 11 health plans to be in the exchange. For us, we're one of 5 health plans on the individual side here. Okay. We were certified for NCQA. This is important for some of your clients to look at sort of quality measures. NCQA, National Commission on Quality Assurance. They're the folks that administer HEDIS, so we got accredited by them. You may also hear about URAC. URAC is Utilization Review Accreditation Commission, sorry. That's the other one, but we chose to seek NCQA certification. I think Kevin's going to talk about that a little bit later. For San Francisco, we are #1 in terms of Medicare, of Covered California enrollments. So thank you all very much. And we're also a good fit for like a lot of local labor and trust groups. So Teamsters just signed up with us, and we're going to be doing a special open enrollment with them. Okay. This is myths and facts. You can read about it. I think I just hit the nail on the head. You don't have to be Chinese to join. It's a misconception. You don't have to be Jewish to be at Jewish Community Center. You don't have to be Christian to go to YMCA. Anyway, you get it. Okay. So I'm just going to highlight a little bit about our delivery system. This is a good graphic. If nothing else, just remember this. So this is our service area, San Francisco and San Mateo County. So if you live or work, you're good. What I have here on this slide, the red triangles are all the hospitals that we have contracts with. Obviously, a lot of the docs in our network came out of Chinese hospitals, so they prefer to use Chinese hospital. But we have contracts with other hospitals, okay? All the way down to Mills Peninsula down here. You'll see that there's a lot of speckles in blue. Those are our doctors, PCPs and specialists. We have over 400 doctors in our network. Over a quarter of them are PCPs. Why is that important? That's important because we are an HMO. We want to make sure that a patient picks their PCP, works with their PCP to coordinate all the care. So if they have, an ankle fracture, they can work with their orthopedic surgeon, get it done, get it taken care of, get meds if you need them. But if they're diabetic, they can work their immunologist. If they have allergy problems, they work with, and so on. But then they all get that coordinated through their PCP. 60% of our doctors, even though they're independent, they use the same electronic medical record. That's important because you want to coordinate lab results, test results, and that sort of thing. So we're continuing to work with our physicians to coordinate the care. We do a lot with population health management, chronic disease management, health and wellness, and I'll get to that a little bit later. We know that sometimes independent physicians can't do it all. So we have sprouted up in different locations these health clinics that are part of Chinese hospitals. So we have one in the Sunset District at 30th and Noriega. We have one in the Excelsior District at Paris Street near Geneva. Daly City, that's on Skyline Boulevard right across from Ranch 99. Support Health Services, which is on Pacific Avenue between Stockton and Powell Street. And then we're opening up a new mega clinic on Gellert Avenue, which is near Serramonte Boulevard and Serramonte Shopping Mall. So that's easy to get to. So as the population grows, as the need for coordinated care grows, we continue to build more clinics. Okay. Personalized service. This is probably the best reason that your clients choose us. It's our personalized service. This is about our member services department. Every health plan has a member services department. You have an 800 number and so on. We grew up out of the community, so we actually have a storefront member services where you can actually walk in. Okay, that's important because yes, it's important that you call the toll-free number and someone answers, within X amount of seconds, that that their abandon rate is below 5%. We did that. We did that even with the ramp up of Covered California. So we actually, the service level, the number of calls that we got increased by 40% just in that ramp up that I think you all felt. But our abandon rate stayed below 5%. So if you called, maybe 1 in 20 hung up before they actually got to the live person. Our average speed of answer, 92% of it is below 30 seconds or less. We actually pick up in less than 10 seconds. Okay, we actually have people they're dive bombing those phones and picking up. Okay, but what's even more impressive about this is that, remember I said, we believe in face-to-face. We want to encourage people to walk in and say, I don't know what this deductible is. I'm not sure what a co-insurance is. Why silver? All this complicated stuff. What's on the formulary? What's tier 5? I don't get that. So those, typically it's not just one question, it's about 3 questions. By the time someone's calling, it's going to be a handful of questions. So our staff, and this is Irene Lewis, she's been with us for more than 25 years. She won't let me tell the real number. She was born there, no, just kidding. But 45% of our encounters are walk-ins. So you can imagine people walking in and just having a conversation about what's my benefit, who's my doctor, what about this, what about. And we handle that and the inbound calls, and we satisfy all the service levels. So that's very important for you to understand. I have this slide, because sometimes people who are new to us always ask the question, well, what if I'm in Kansas? Do you cover that? Well, yes, if it's an emergency, we'll cover it. We follow prudent layperson rules. If it's an urgent care issue, we cover it. Sometimes it's not smooth because they say, well, I'm going to bill you, Mr. Patient, and get it back from the member. No. We try to discourage that. We'll make it right. But we want to make sure that people understand emergency is covered. We actually have contracts that we can access in other parts of the U.S. Okay. We have a nurse advice line that, again, it's a requirement. We have a 24-hour nurse advice line. But what's more important than the 24-hour nurse advice line is the ID card. And we put the PCP's phone number in front so that if there's any issues, call your PCP first. They're accountable to make sure that they get back to you. If they're not getting back to you within 30 minutes, we need to know that because that's a standard that we set. But most of the PCPs are very good about that because they want to coordinate your care. As I alluded to, wellness, prevention, and health outreach is very important to us because we don't want to wait till you get in the hospital to try to keep you well. We want to make sure that you have access to programs, you understand what your ailments are, that we have programs in your language to improve your health. And so all of our members and all the patients in our delivery system get this quarterly health newsletter with relevant topics like, for example, May is Hepatitis Awareness Month. So what do we do to encourage people to get screened for hepatitis, make sure that all your hepatitis vaccinations are up to date. September, going back to school, we want to make sure that not only do the kids get the Tdap, but also there are these other compounds that they need to follow on a schedule. So we publish that on a quarterly basis. It's bilingual, so a lot of our current population speak Chinese, so we have it in English and Chinese. We have classes about maternal infant nutrition, childbirthing. So for example, when people are expecting kids, we have a Lamaze class. Well, we have it in English, we also have it in Chinese, Cantonese, and Mandarin, because it's important for that whole birthing process. And then we also have health and fitness classes that we don't just centralize in one location. We actually have them in our clinics, and we also have a partnership with Chinatown YMCA for that as well. So those classes fill up, they're free to CCHP members. So we publish the schedule so yoga, Tai Chi, I'll tell you those fill up really fast. So if you have clients who want to sign up for those classes, get them in fast. And we package this in our Live Healthy, Live Active program. We're starting to pilot out incentive programs for, like if you do the Senior and Fit for a series, what can we do? So that's something that we're working on this year. It's not fully fleshed out, but I wanted to let you know that we're working on that. We are piloting 4 workplace wellness programs. So we're working with some of our large employer groups to try to figure out, to look at their population base. What are some key things to work on? Let's say it's hypertension. What can we do with the employer to reduce hypertension? So those are some of the things that we're going to be rolling out. Any questions so far? Because I'm going to leave the stage. Great. Kevin, I'm going to turn over to you. So Kevin Rowland may be new to many of you. I didn't talk about my background. I'm literally, you all know I was born in a Chinese hospital. But in addition to that, I've worked with 6 different health plans: Kaiser, 2 Blues, Group Health, and a startup, Medicare Advantage startup. But I'm really happy to be back in this delivery system. Kevin Rowland's been in the industry. Are you going to talk about your background? I'll let you do it. All right.
Way too long.
Okay, sorry.